They started an IV in when in the recovery in my hospital room, just a saline solution to keep me hydrated. I had a lot of neck pain too from that CO2 that's supposed to dissipate. They were constantly taking my vitals, and it was a very miserable night in the hospital, to be honest with you, as they're always checking the vitals, or they're giving you some medication for something like the anti-nausea medication. They're coming in to check the IV. If the IV, gets low, then they've got to come in and replace that. If they've scheduled medication at 2 o'clock in the morning and you're trying to sleep, they don't care. You're going to get your 2 o'clock medication. They're going to come in and give it to you, which I guess that's what they're supposed to do. I did have those intermittent pneumatic compression, which I call leggings. Somebody might call socks, but they're on your legs. And those were an automatic compression alternating between the left and the right leg. And that was to prevent any blood clots. So I can understand that was very necessary to have that, but it does go off every 15 seconds, and it goes off all the time that you're laying in that bed. So that doesn't help to make you go to sleep. It is just one of those things you have to live with, but that's what that's what I called intermittent pneumatic compressions on the legs. Oh, I was able to hold a conversation, like I mentioned, after I recovered with my wife and my stepdaughter, after about 30 minutes in the motel room, I wish, hospital room. I was able to drink a little bit of ice water, but the ice water I don't think was very good for me, because number one, it was too cold, hard to swallow. Also, it was out of a straw, and I found that it was easier for me to drink from a cup than it is to suck on a straw trying to get something down. I did have a very, very bad headache. Now, it could be from not eating, because I did not eat for about, I think it was probably 8 o'clock at night before the operation, and the operation was not until 10:30 in the morning. So I went about 12 hours of not eating, which usually does give me a headache, but the headache was just absolutely terrible, along with the shoulder pain. And that might have been from not eating and the anesthesiologist. Of course, the CNA came in often to take the vitals. I was later I'd say early in the morning, I was able to lay on my left side and fall asleep for about 30 minutes. That seemed to help. So it wasn't any pain laying on my side. I didn't have to lay on my back, but I was able to negotiate that. Oh, let's see. And I stayed awake from about 3:30 a.m. till about 5 a.m. and then was able to fall asleep after that for a little while, because the oncoming shift, I could hear them outside my room conversing, and so they were, I guess, passing on information about the patients, and they kind of left me alone for a little while. Okay, so when I got up in the morning, I wouldn't say got up, but when I woke up around, it was still somewhere between 5 a.m. and 7:30, I guess, a.m., they did bring me some applesauce and some cranberry juice. I did have more pain in my stomach, which is in the abdomen from the incisions, I'm sure. And I found out that I was on what they call a full liquid diet. It's not a clear liquid diet, it's a full liquid diet, and I'm not going to explain all that here, because you can look that up on Google or YouTube, and they'll explain what the full liquid diet is. Basically, to put it in a concise sentence, anything that's liquid at room temperature you can have. So I've been on that now for 6 days, And oh, by the way, I've lost about 6 pounds. Okay, so I was able to eat a little bit of the applesauce and take a little bit of the cranberry juice. And then also, I was having trouble getting the water down. You know, I told the CNA, so they actually had a thickener that they put in the water. And I don't know what the thickener is, but I got them to get rid of the ice water and just have water with this thickener in it, and that helped me be able to swallow the water. It was kind of interesting. I never had had that before. It didn't taste really bad. It didn't taste much of anything. It was just a thickener in the water. It helped. I also was able to get 2 Excedrin, and I actually had to call a RN to get 2 Excedrin because they could give me Tylenol, which Tylenol for me is useless. The Norco pain medicine helps, but I could take 6 or 8 Tylenol and it won't get rid of my headache, but 2 Excedrin normally does. So it's kind of interesting. I had to get an actual RN to find 2 Excedrin for me to help with my headache, and thank goodness she was able to get it for me. I don't know what that 2 Excedrin is going to cost me, but I'm sure it's going to be a lot more than what they sell it for at Walmart. So anyway, that seemed to help. After I got home, I just rested. That was it. The wife drove me home. Of course, I was kind of just wiped out. Not excruciating pain, except I still had pain in my shoulder. In fact, if I burp right now, I can get a little bit of pain. And I think I talk a little bit about the burping. I've listened to other people who've had this surgery and they could not burp. And I don't have any problem burping. I don't belch, real loud or anything like that, but a little burp, it does still hurt a little in the abdomen and even in the shoulder, but I can burp a little bit, which seems to help. So surgeon must have done real good with that, whatever he had to do. So after we got home, I just ate a little bit of yogurt, which I don't care for yogurt, but that's supposed to be better for you. I had a little bit of watermelon juice, and then I just slept on and off. I did have some pain and discomfort in my abdomen incisions. I'm sure I took some pain med at the time. Just one Norco, that it's the 5-325 opioid. I didn't have to take a lot of it. It does, like I said, hurt to burp, and it does hurt to cough. It hurts the abdomen. Sitting and standing, you can feel it in your abdomen, so you don't want to sit and stand any more than you have to. It might be a good idea to push a pillow against your chest, your abdomen, when you're getting up and down. That might help. I know it helps heart patients. That's why they give them that pillow. So they get up and down and squeeze the pillow against their abdomen or chest. And then that was about it for the second day. I slept fairly well at night. Of course, I get up and urinate 2 or 3 times if necessary, but it was much better restful getting out of that hospital. It was not a fun night, the first night after the surgery. So the next day, I still had some minor pain in the abdomen. I drink Fairlife protein shakes, or I actually drank a Fairlife protein shake. You can have Boost or the other ones that protein shake. Don't try to gulp it down. You got to kind of sip it down. But I guess that should be good for you, having the protein. So we did like the Fairlife and bought some of those. And that would be kind of a breakfast. I did have some chocolate yogurt for lunch. I had some banana yogurt for dinner. And that was about it. I just rested and watched TV. I'm not having an extreme amount of pain at that time, especially if I'm just laying back and watching the TV. Just sipping on some juice and eating the yogurt or pudding, whatever you might have. just to stay on that diet and rest as much as you possibly can. I was afraid to do anything. I don't want to lift anything or stretch or bend too much or overdo it. You just have to remember, even though I'm 71 years old, I'm still pretty active. I like to play golf, and I work in the yard a couple of days a week, cleaning up, trimming bushes or spraying for weeds or cleaning up dog poop or whatever you have to do. And I'm used to being outside more often doing things. And it's hard to limit yourself to not do anything and to sit around and wait for your body to heal. Okay, I'll move on to the next day, day 4. It seemed like I was very weak in the morning. I don't know if it's just from the diet and not getting the nutrition I need, but I just remember the next day, that was the day I rested in bed almost until noon. For some reason, I just could not get up and take a shower, and I've been taking a shower every day. I don't run the water on my steri strips that are covering the incisions, but I still wash it off with some mild soap. But for some reason that day I was just wiped out. Just could not get going. Finally got up and got my shower, and it was about noontime by the time I got up to sit down to watch TV. Again, I had a Fairlife protein drink for breakfast, and also I had ended up having 2 pain pills because I just didn't feel really good on day 4. The next day, day 5, which would have been a Friday, I had slight pain in my abdomen. The top incision is interesting. I have 5 incisions on my belly, but the one that's the top one above the belly button, kind of like in this area right here, that one is the most sore, and I don't know why. I'll ask the surgeon about that. But it's very tender to push on, and I noticed that it was turning black and white like a bruise. So of course I'm very careful when I stand up or sit down, and sometimes I'll just hold my chest like this when I stand up or get down, and that's where the one incision hurts the most. A couple of other ones don't hurt at all, even when you push on them. Just very minor pain again in my left shoulder. I think they said, somebody I read, 10 to 12 days to get this gas out of you, where you still could have some pain in this area here. And hopefully that'll go away. I did get hungry. The diet that you're on is not very filling. I cheated a little bit. I put some Cheerios in some pudding and soaked the Cheerios in there, but I found out that eating Cheerios, you can really chew those up so fine in your mouth that they become powder just about, and then just wash it down or eat it with yogurt. I've had no problems with my stomach eating something like that. I don't know, maybe I'm restricting myself too much, but I'm trying to follow this full liquid diet. But you start to get hungry. You want something solid. And no, you can't go get a hamburger and french fries. It doesn't work that way. Darn, I can't even eat pizza. So you just have to live with it. And that's probably why there's a lot of weakness you're going to feel, because of maybe the nutrition you're not getting, but try to get as much protein as you can. And sleep was okay that night. And then the next morning, Saturday, this would be day 6, which is yesterday. Low energy again. And I weighed myself, and I was 177.2. If I remember right, before I went in for any surgery, the Sunday before the Monday I went in, I weighed about 183. So by Saturday, about 6 days, from 183 to 177. So what's that, about 6 pounds? And I decided too I think it was Saturday, maybe it was Friday, but we went to Natural Grocers, and I picked up some liquid vitamins, just a small bottle of it. It's quite expensive, and they were the Nature Plus Source of Life liquid vitamins, and they look terrible because they're just dark green. I just took a couple of tablespoon, I think that's what they recommend, a tablespoon of the vitamins, or 2 tablespoons. Hopefully that gives me more energy. So I've tried to supplement with even liquid iron, a little bit of liquid iron, and you get that at the health food store also. And also the liquid vitamins I'm adding to my diet, which was actually, I believe it was yesterday, Friday, when we got them. So I continued on Saturday, well, yesterday was Saturday, to continue with the liquid vitamins. And there again, you're eating Jell-O, gelatin, pudding, yogurt. I did have some soup my wife made that was basically pureed. It did have some meat in it. It had some chicken in it. Did not affect my stomach at all. I was able to get it down. Of course, I do still drink plenty of juice along with my meals. It seems to be getting better today, which is Sunday, that I can swallow a little bit easier. You're so used to when you're drinking before your surgery that you could just take a big gulp of water if you were thirsty, or you're coming in after working out in the yard and you want to suck down some cold water. And it doesn't work that way after the surgery. You got to kind of sip on it. And actually I found that it's even better at like room temperature juice. So, and here we are on Sunday, the 7th day. I guess we'd call it 7 days, including the day that I had my surgery. I lost another pound overnight, down to 176.2. So that's about 7 pounds I've lost. And just having my protein drink, again, the Fairlife protein drink. I took 2 tablespoons of the liquid vitamins, and my swallowing seems a little bit easier today. And that's kind of a wrap up I'm going to do it's about almost 20 minutes here of talking. I'm sure I've missed a lot of things I want to say, or probably haven't answered a lot of questions you may have. If you can contact me, I'll try to answer those, and I'll try to get this video out on YouTube. As I said, I'm no expert on how to do it. And then we'll continue from here and see, when do I get a chance to actually eat a piece of pizza? How much can I lift? What's my restrictions, etc., etc. And thank you very much for watching my video, and I hope you found this beneficial to you, and you have a wonderful day. God bless. Take care.